Welcome to Season 3 of the To Health With That podcast, where we break up big topics into small bites. I'm your host, Dr. Amy Newsel, and I'm joined by my dear friend, women's health and fertility expert, naturopathic physician Kate Nomas, to break down infertility, hormones, and the whole baby-making shebang. This week, let's talk about one very common cause of fertility issues that's happening entirely outside of the reproductive system. We've mentioned it before, but today we're going to focus in on your thyroid and its effect on fertility and pregnancy outcomes. So hypothyroidism, which is low thyroid, may cause women to miss periods altogether or to have less frequent periods due to lack of ovulation. And if we don't ovulate, we can't get pregnant via intercourse. Hypothyroidism is usually diagnosed with an elevated TSH or thyroid stimulating hormone lab.
Right, exactly. So women with overt hypothyroidism, elevated TSH, may have either oligo or amenorrhea, meaning they're ovulating less frequently and having less periods, or not having periods at all. And thus we call that ovulatory dysfunction, and this results in decreased fertility. However, the interesting topic we're going to talk about today is the effect of subclinical hypothyroidism on reproduction, because that's not as well defined, and I think it would be interesting for us to chat about.
And so just to be clear, subclinical hypothyroidism means the TSH is technically within normal limits and the thyroid hormone levels are maybe lower than optimal, but again, still within normal limits. So women with subclinical hypothyroidism very often have minor symptoms of low thyroid or more major symptoms, but the hormone levels aren't considered abnormal enough to warrant a prescription. So Kate, what does this group of women have to consider in terms of fertility?
Great question. There is evidence of an increased risk of miscarriage in women with subclinical hypothyroidism and in euthyroid women, normal thyroid, but with TPO antibodies or thyroid antibodies. And I will note that very often I will see fertility specialists put their clients on thyroid medication if they're having trouble conceiving and they have a TSH above 2.5 and they're trying to get it down to about 1.5.
Amazing.
Mm-hmm.
I want to add an aside here too, to say that women who have MTHFR polymorphisms are also at greater risk for hypothyroid conditions, as well as repeat miscarriages. So there may be some big picture link here, but that research has yet to be done. So, Kate, do you suggest routine thyroid testing, I'm assuming, for women who are trying to conceive?
I absolutely do. And I wanted to jump back to your MTHFR comment. That makes me want to remind women to take their high quality prenatal if they're also struggling with subclinical hypothyroidism. And so back to your question about testing, I think screening is reasonable since there is evidence of an increased risk of miscarriage in women with subclinical hypothyroidism and in normal thyroid women, euthyroid women with elevated TPO or thyroid peroxidase antibodies. Of course, thyroid function should be assessed in women with clinical manifestation symptoms of hypothyroidism or a personal history of diagnosed thyroid disease. But just to be clear, screening asymptomatic women who don't have symptoms of hypothyroidism for subclinical thyroid dysfunction is still controversial. Amy, can you tell me if thyroid function is important for male factor infertility as well?
Turns out it is. It's just as important for the male partner as it is for the female partner. And studies have shown that either excess or deficient thyroid hormones result in the alteration of testis function, including semen abnormalities. So more frequently, hyperthyroidism or high thyroid function has been associated with reduced semen volume and reduced sperm density, motility, and morphology, whereas hypothyroidism or low thyroid is associated with reduced sperm morphology.
Wow, cool. That's interesting. Right. So it's an easy lab test to run, and we should run it on both partners.
And inexpensive, right? This is not, It's not a break the bank type test, and it's something that you can get in any town, regardless of, specialized medicine or not, right? This is a general practitioner thing.
Absolutely. And I'd add to that that it is part of the infertility workup. They will run a TSH usually, almost always.
That's good. That's good. So the bottom line, men and women struggling with infertility, it's important to dot every I, cross every T. And in this particular scenario, thyroid testing might just be the T here. That's a bad joke, sorry.
I liked it.
Okay. Oh, geekery. Also, this is a great option for naturopathic care, right? This is something that naturopaths do really, really well.
Absolutely right. That subclinical hypothyroidism is a great intervention point for ND care.
Yeah, exactly. That's where we can support thyroid nutrition, support the nourishment of the thyroid, even pre-giving thyroid hormones, and see a big difference.
Yep.
So when you're experiencing fertility difficulty, or if you're having any troubles in that range, ask your doctor to test your thyroid function if they haven't already, especially if there's thyroid disease in your family or symptoms of thyroid disease like ongoing difficulty losing weight, fatigue, chilliness, puffiness, or swelling in your throat area, like any sort of heaviness here. Dr. Kate, thank you.
Thank you so much.
Thank you so much for listening today and sharing your time with us. If you like this show, please follow and maybe even leave a review. Or like and subscribe if you happen to be watching on YouTube. Visit naumesnd, naumesnd.com or to healthwiththat.com for more information about Drs. Kate and me, Dr. Amy.